Sonography of vesicovaginal fistula. Vesicovaginal fistula is an abnormal opening between the bladder and the wall of the vagina. The result is that urine leaks uncontrollably out of the vagina. Causes include injury during pelvic surgery, injury during cesarean section, traumatic injury, congenital, meaning the person can be born that way, prolonged or obstructed labor. Labor is said to be obstructed when the baby is finding it difficult to pass through the birth canal, sexual trauma, especially when it happens during the prepubertal age, assisted vaginal delivery, when equipment or some instrument has to be used to assist vaginal delivery, and radiation therapy. Clinical presentation of vesicovaginal fistula. It includes continuous incontinence, that is involuntary leakage of urine through the vagina, dyspareunia, painful sexual intercourse, and the patient may be smelling due to odor from the urine. Vesicovaginal fistula is classified into simple fistula and complex fistula depending on the size of the fistula. When it is less than 0.5 cm, it is called simple. When it is above 2.5 cm, it is called complex fistula. This sonogram shows a case of vesicovaginal fistula. You can see the uterus and the urinary bladder. The arrow there is pointing at the fistula between the bladder and the vagina. The funnel-shaped hypoechoic area there represents the urine that is leaking from the bladder into the vagina. This woman has continuous incontinence, dyspareunia, and history of CS, 4-month-old CS. This is a video of the case of the woman I attended to with vesicovaginal fistula. You can see the arrow pointing at the fistula between the urinary bladder and the wall of the vagina. You can see the hypoechoic clear fluid collection in the vagina representing the urine. This is a typical case of vesicovaginal fistula.